Jackson Hospital team. And we are so excited to hear about the Jackson Hospital team. They are located directly south from Fairview, so we are excited to hear all about them. Good morning, Keith, Mary Catherine, and Mia. It is great to see you all. Let's take a quick 10 seconds and give some introductions. Keith, you want to go first?
Sure. Hello and welcome, everyone. I'm excited to be here today to share with you the Jackson Hospital and Clinic family. My name is Keith Pretzman. I am the Assistant Vice President of Human Resources here at Jackson Hospital. In Jackson Hospital, if you don't know where we're located, we are in the state of Montgomery. We are centrally located in the middle of the state. Joining me today is Mary Catherine.
Thank you, Keith. Just a quick intro. We're going to give you your 10 minutes. You're going to tell us all about Jackson. Just wanted to hear a quick intro from you.
Okay.
All right, Mary Catherine, you want to go next?
Yes, so my name is Mary Catherine. I have been at Jackson Hospital for about 10 years, and I'm one of our nurse recruiters.
Wonderful. Well, I'm sure we're going to hear some good insight from you. And Mia, would you like to go next?
Hey, good morning, everyone. My name is Mia Legal, and I've been working at Jackson since last year, so it's been a year for me there.
I'm sure we'll hear some good insight there then. All right, everybody, you know the drill. You got 10 minutes on the clock. Ready and go.
All right, before I'm going to share an overview video of our organization. I just want to say this is a fairly new partnership we have with Connetics USA. It's been a wonderful experience, and we're eagerly awaiting having our first group of approximately 100 RNs and 10 medical technologists to join us soon. So without further ado, I'm going to share video.
Clinic in Montgomery, Alabama. Our Jackson team enjoys a rich history of 77 years caring for the communities in the River region. I invite you to join our Jackson team, where you'll find a family that cares for you and your professional growth. Most importantly, you'll help us live our mission of caring for all those we serve.
As with anything, any great company, it starts with a team. Everyone plays their role. Bring it together.
All the patients belong to everybody. You know, we help each other, we bounce ideas and thoughts off each other, and we get the help that is needed to really do the best for our patients.
I feel like everybody communicates really well here. It's a very welcoming environment. I don't ever feel uncomfortable to approach physicians or even the higher management here.
There's a good support system. I didn't know everything when I came over here, but there are people who are willing to help.
You feel like you're working with your family and friends. It's not about me, it's not about the nurses, but it's about the patient.
Just this morning, ran into the CEO, and he knows you by name. And that's what I just love about him. You're not just an employee.
Montgomery is a good place and somehow relatively peaceful.
It's just very welcoming, quiet. There's a lot to do, a lot to see.
We have a great zoo here, the Biscuit Stadium for baseball, a new water park. There's a lot of entertainment downtown Montgomery, good food.
Who doesn't like good food?
It's a diverse area. You can do pretty much anything that you want to do.
Good for me, especially the weather situation.
Nice and sunny most of the time.
And I think things are also cheap here compared to other states. Things are relatively affordable.
It's really good being here in Montgomery.
I think it's a privilege. It's a dream come true.
I look forward to welcoming you to the Jackson family.
Mary, Catherine, and Mia, you want to share why you both love working at Jackson? I'd like to hear. I'm sure a lot of our nurses would love to hear.
Sure. So I've been here for about 10 years. One of the things that I've loved about Jackson is I've really been able to grow in my career. I started out as a unit secretary and a tech, and Jackson has helped me through nursing school, and I loved it so much that I stayed afterwards. I've been able to explore multiple different specialties and have found a real love for Jackson and the opportunities that they've given me.
Wow, that's so wonderful to hear. I love to hear when, someone starts their career somewhere and they're continuing on. I think that really speaks volumes about the organization. And what about you, Mia? How's your last year been?
Hey, so it's been pretty amazing so far at Jackson Hospital. So since I started last year, my experience has been pretty good. I have had a great support from Jackson Hospital. Everyone inside as well as outside the lab are super helpful and supportive. And I am originally from Nepal. Sorry, I forgot to introduce earlier. And so I feel beyond blessed to be working at Jackson because of the support that I get from the hospital. And Jackson Hospital is also constantly updates. They constantly update the machines that are used in labs. So we are fully equipped with the newest instruments that could be available in the lab, which makes our work so much easier and faster. So as a whole, I think Jackson Hospital is a very diverse hospital, and there are doctors and nurses from all around the world, and I really like working at Jackson Hospital. Thanks.
Wow, wonderful to hear, Mia. I know Keith mentioned that 100 RNs are coming to Jackson, so I'm sure there's going to be a huge international community. I know it's already growing there.
Real quick, some overview slides before we talk specifically about more nurse recruiting efforts. But we're Jackson Hospital. We're a nonprofit community hospital. We're serving patients in the city of Montgomery and the surrounding communities and counties for 77 years. We're licensed for 344 beds, and we've got over 2,000 employees and physicians here. Um, we're also fortunate. We operate Jackson Clinic, which is the river region. We call ourselves a river region here in this area, the largest multi-specialty clinic in the region. We've got over 100 providers with over 22 specialties, including family practice. We're very fortunate. We just, in this past summer of 2023, we started our first family medicine residency program. So we're very fortunate to have our first group of PGY1 residents. We have 6 of them. We also have 2 PGY2s joining us. So we look forward to the coming years where this program's growing and assist us, especially in the clinic area, from seeing our patients. We're very proud of all of our awards in technology here, but we want to highlight a few of our technical advancements. The robotic surgeries, Da Vinci surgical systems that we have in our surgery department, Watchman procedures, TAVR procedures, in the EVAR procedures that we now perform here, and fortunately, those are being performed in our new interventional radiology center. So we're very excited about that. As we said, living in Montgomery is great. Montgomery is centrally located in the state of Alabama. We are the capital city of the state of Alabama. What's great about working here is, from a home perspective and work perspective, it's a fairly medium-sized city. The proximity to work, schools, home are very close. Not a lot of traffic. Our weather, we have great weather here. We are in the deep south, so to speak. We do have, I guess, mild winters. You're not going to see a lot of snow here. You'll probably go several years without seeing snow. The summertime, the springtime does warm here because we are really further south than most of the states. We're very fortunate as far as higher education. We're very fortunate that we have several universities, large universities, in close proximity to us to facilitate professional development, career development, educational development. Our entertainment, our art, sports, culture environment is very diverse here. Besides professional sports, minor league sports, just general family, individual entertainment, we have it all here. So it's an exciting place to live. Being centrally located in Alabama, we're close to the beaches, we're close to the mountains. You can get down to the Gulf Coast or the beach areas in less than 3 hours. You can go about 3 hours north of Montgomery and you'll be in the foothills of the Blue Ridge Mountains. So we're very close proximity to different geographic regions. We're 2.5 hours from downtown Atlanta. So that's a great advantage of being centrally located in Alabama. And real quick, I'm going to pass it off to Mary Catherine again so she can talk about nursing at Jackson Hospital.
So we have multiple areas available to our nurses. We have orthopedics, neurology, post-cervical. We have a urology floor. We have our med-surg oncology. We're actually building our pediatrics for Jackson. We have a full range of women's services, postpartum, labor and delivery, and nursery. We do have some of our specialty care units, the emergency department, critical care. We have a CV-ICU or open heart unit. OR, PACU. We do have a cardiac step down and a progressive care, which can also be called the ICU step down. The professional development is one of the things that we love about Jackson. They offer a lot of different opportunities. Of course, we're a Daisy Award participant. We have a clinical ladder. We have our nurse residency program, our simulation lab.
All right. Yeah, you hit that 10-minute mark, but we got a lot of good information in. So thank you so much for sharing, Jackson Health Team. As I was listening to everybody, you know, right in the beginning, when you had one of the nurses on that said the CEO knows you by name, I think that speaks so highly to the community that you have at Jackson. A welcoming, quiet environment, which sounds like it's perfect for an individual, perfect for a family. And one other thing that really stuck out to me, so I live in California, and I saw the low cost of living, the median house price under $200,000. I think in California it's somewhere around $1 million. So a super affordable cost of living, which is I'm very jealous about. That sounds amazing, especially with the happy weather that you get. Sounds like a wonderful place to move to and consider for international nurses. So thank you so much to the Jackson team. If you are interested in interviewing with Jackson, you can apply online, amnhealthcare.com/international. Our recruiters are on hand and they are excited to get you slotted into the Jackson interviews. Please consider joining their growing team. They already have got 100 RNs they're waiting for. So let's get them more. All right. Thank you, Jackson team. Bye-bye.
Thanks. Bye-bye.